Welcome to Advanced Nurses. We connect with nurses who inspire other nurses by sharing their experiences. And so we're able to bring that information to you. Hi, I'm the educational consultant with Advanced Nurses at ACD4N, and today I have Briana Davis. She is an inpatient CDI nurse, and today we are going to be talking about the differences between inpatient and outpatient CDI high level, but more importantly, we're going to learn about Miss Davis's work and also, what led her into CDI and how you can transition into CDI. So let's just start with Miss Davis. Would you just mind sharing with us your background and how you got into nursing and then how you got into CDI?
Sure. So I'm in the southeastern part of the U.S., working inpatient as a CDI specialist. I starting off as far as nursing journey. I became a registered nurse in 2017. My initial degree was in health education, and I always, even in my health education program, I wanted to go back and do the RN. So immediately after graduating with the Bachelor of Science in Health Education, went back and did the associate degree nursing at the community college level, a night program, and went ahead and knocked out that 2-year program. And then I started in working as a inpatient registered nurse, an array of different experiences, med surg, PCU, telemetry, working during COVID, so vaccination, pulmonary, critical care, cardiovascular, critical care. And that's kind of just an overview of some of my experiences. I did do travel nursing for about 2.5 years and then just became burnt out and was looking for a way out. I kind of didn't have any friends or nurses that I knew that had navigated outside of inpatient nursing. Aside from family nurse practitioners and psychiatric nurse practitioners, I didn't really know of any nurses that had progressed outside of the hospital, outside of bedside, into roles working at home and just having that work-life balance. So that's what kind of led me into remote CDI nursing. Honestly, that's just kind of a snapshot, and I can go into more details about that next step directly from bedside travel nursing to CDI nursing.
I want to hear the details.
Okay, sure. So I was working my last contract, and this was in 2023. I believe it was maybe May or June in 2023. I believe it was May. And like I said, that whole year, 2023, travel contracts after COVID, just completely burnt out and ready to pivot outside of bedside nursing, ready to see, I had friends that worked in IT, had friends that worked in all these different areas, and they were working from home. And I was just curious, as a nurse, what can I do outside of the hospital? What skills, what different specialties of nursing, because I know there were some. So honestly, I got online, started doing research, and I just jumped right in. I started applying to roles, some roles that were within CDI nursing, some roles were not. And honestly, I just was eager to pivot outside of bedside nursing. At that time, looking back, I probably was doing things a little blindly because I was so eager to get outside of, to break away from bedside nursing, just completely burnt out. But I ran across a role at a local hospital near me, and I applied to that role. And before this role, honestly, I had applied for probably over 100 remote nursing in general, not CDI, but remote nursing roles where, like I said, I jumped in blindly. I didn't have a concrete plan, and I didn't have any mentors. So I kind of was just winging it, just kind of eager to leave, just being persistent. but I didn't know exactly the steps to take. But like I said, I ran across the CDI nursing role at a local hospital. I applied, and honestly, it was very short. Within 1 week, they replied back, invited me to do a test, an exam, where I guess some hospitals are doing these. It's kind of like a test where they're just gauging what you may know about CDI, or how well, giving you an array of different CDI questions to see your level of critical thinking, to see, how you may perform so that they can move forward to the next steps as far as with the interview. So they sent me this exam. I completed that exam, sent it back. And then from there, like I said, everything went pretty quickly.
What did the exam consist of?
That exam, and I probably could pull up some of these. Give me 1 second. Let me pull up some of these things so I can give you some good real life examples. Just give me 1 minute, okay?
Sure, thank you.
So the CDS test, it kind of had an array of multiple choice, short answers, case studies, and like I said, it had an array of different areas of nursing. The case studies just kind of went into like what you would see on pretty much on a CDI day, and just they were trying to gauge how well you would, I guess, pick up this critical thinking even before coming into the role. So the first few questions, I believe the first 7 questions were pretty general, just multiple choice nursing questions, identifying disease based on, hey, this patient has this, this, and this. What underlying process is likely responsible for the patient's confusion? What would be the most likely indication for placement of a certain device? Just general nursing questions, the first few. And then after that, like I said, it went into these short answers where I felt like as the test progressed, it got a little bit more difficult. So what is the likely etiology for this type of condition? What type of pneumonia is suggested by these clinical circumstances? After they give you all these details, having you identify the type of pneumonia, what acute respiratory conditions are suggested by the clinical indicators, explain your answers. So that was the next few questions from, let's see, the short answers about 1, 2, 3, 4, 5, 6, 7, 8, 9 questions, short answers in that style. And then the last few questions, like I said, it kind of got a bit harder as the test went on. The case studies were kind of very long, drawn out, kind of like how you would see in a chart, giving you the labs, the medications, let's see, interventions that were taking place, and just having you to identify what the primary condition is suggested by the presenting symptoms, identify clinical indicators that led you to these conclusions. Another question, identify 6 abnormal physical findings that need further clarification, and the clarification that is needed for each one. So those case study questions, very much more detailed. They ended the test. It was about maybe 4 or 5 questions for each case study. So those were very much more detailed questions. And like I said, they gave you way more information than you probably needed. So some nurses may get overwhelmed when they see all these paragraphs of information related to a patient their diagnoses, their neurological exam, their meds, their history, just overall going through each step and process, and then having you listing out 5-6 questions and having you pull out information from what you read in that study. And then when you're done with it, send it back to the CDI supervisor. It sounds like they would grade it, and based on how you performed, they would then set up a 3-hour-long interview with 3 different supervisors from 3 different community or 3 different entities under the same hospital. So that's an overview of that CDI test and kind of what was on the test, what was required on that test, kind of the nerve-wracking, getting the test done, sending it back, and then hearing back from them, hey, congratulations, you passed your proficiency test. Let's move to the next steps, which was a 3-hour-long interview.
Wow. So already I can hear that you had scenarios that you had to go over. Now, it didn't sound like there were any coding questions. These were like more so focused on like clinical validation, like ensuring that we're looking at the right diagnosis, the right signs and symptoms, matching up with the right diagnosis, and looking at kind of like more of those clinical indicators of certain diagnosis. That's what it sounds like the exam was more focused on that than coding, because there was no coding on the exam, correct?
Correct. So no coding at all. This was just, for me, after going through the 3-hour-long interview, they don't expect us to know much about coding. They didn't expect me to know much about coding at all. You have a one-on-one preceptor the first 6 months that goes over coding. And of course, coding is kind of a lifelong learning process. It changes. You kind of, you learn it on the job. So prior to hire with this proficiency test, this 27 questions from this particular institution, there was no CDI coding, no coding in general. That wasn't their expectation for you to know. They were just assessing your baseline, able to identify, like you said, clinical indicators, diagnoses, diagnostic tests that you would run. Is the patient hemodynamically stable? Just general nursing questions, interventions, like you said, indicators that support that particular diagnoses, etc.
Okay. And I'm just glad you clarified that, because, it's one thing when you're telling someone that they can get into a particular industry, and there's another thing when you are able to describe to them with detail what that process looks like, because that's really where that reality check comes in at. Because one thing that I really want all nurses who are listening to this, or anyone who's interested in nursing, to understand through this discussion is that nursing is very dynamic. And even amongst these niche areas, you still see the dynamic nature of nursing. So I think that also would demonstrate for any nurses listening to this content, or prospective nurses, to see even how different, even risk adjustment and working for a hospital, like Briana works for a hospital, right? So CDI working for a hospital is different than CDI working for a payer. Okay, so we need to make sure that nurses know that you even have options within the type of CDI that you do and where you work within these CDI roles. So what are some skills that you think nurses should acquire who want to transition into CDI?
Sure. So some of the skills that I feel nurses should have or should try to acquire before transitioning into CDI. With my role, it's a hybrid role. So it's one day in the office doing that physician engagement, and the other 4 days is at home. So being able to work independently, self-motivated, kind of, I would say, being a nurse that's patient enough to feel like a novice nurse again. Because going into this field, it's kind of like you're moving into a new specialty area. Just think of it as like you're in the hospital, you're going from med-surg to ICU. It's a completely different area. So you have to be patient. Give yourself time, give yourself at least 6 months to get over that steep learning curve going from bedside nursing to remote CDI nursing. So that's a big one. I would also say, and I know you had told me before, the differences in our experiences as far as being hired in different areas of CDI nursing. But I would say for the inpatient side, inpatient CDI nursing, most hiring managers, I feel they do hire nurses that have acquired a good level of bedside training. So a good understanding of treatments, a good understanding of pathophysiology, clinical indicators, pharmacology. I won't say you have to have critical care nursing. I have witnessed some of my fellow CDI colleagues that have stated that. Some managers may look for that, but in general, you don't have to have only critical care experience. I only worked in the ICU for 6 months. I did PCU for most of my career. So just having an overall good understanding of key diagnoses that CDI values. So when you get into remote CDI nursing, it's certain diagnoses that when it comes to these diagnoses, the hospital values these diagnoses. They put emphasis on these diagnoses because these are the ones that are missed heavily, or these are the diagnoses that the hospital is missing key reimbursements. Or physicians just have a tendency to, when it comes to documentation, they have a consistency of having deficits in those key diagnoses. So it's certain diagnoses that I feel like if nurses have a good understanding and have worked with patients that have these diagnoses, they'll be fine. And also, I think that's about it. Yeah, a good understanding of key diagnoses within CDI, acquired a good level of bedside level training when it comes to understanding treatment, patho, pharmacology, clinical indicators, and in general, just like I said, being open to being in a new field where you're going to feel like a novice nurse again in this particular specialty. And then also having that independence, that self-motivation to work at home with, nobody standing over you, nobody's, you're alone, So being open to working in this type of setting where you're working from home, you have different things going on at home, but just being able to manage and balance your work cues while being at home.
One of the things that I know I had to adjust to was the technology space. That's the technology part of it. I've always been one that's very curious about advancements in technology, especially advancements that directly impact my work as a nurse. So again, like new EHR systems and things like that. I'm always one quick to say, sign me up. I want to be on the the super user team. But one of the things I just know is that when you are working in a space, you have to be very comfortable with software. There's a lot of copy and pasting. You may have to, for me, I have to create educational tools. So with that being said, I have to be very comfortable with things like, PowerPoint, using Google slide decks and creating slide decks using, again, PowerPoint presentations to demonstrate whatever teaching that I'm going to be emphasizing for the physician. And so I have to be comfortable with that. And then you also have all the different software that you have to use to access records and may be able actually to help you with the coding process as well if you're doing any kind of code validation along with that clinical validation. So all of that matters. You know, you have to be really comfortable working with technology and kind of being flexible as that technology improves over time with our workflows. Or if it's not an improvement, but if that technology is hindering, then you should be able to speak to that too. So we have to kind of step up on our our tech savviness, just to ensure that, you know, if there is any kind of problem that we note in using the technology, that we are comfortable speaking on that as well. You know, and that happens because of exposure. So I guess I also wanted to find out from you, what do you think the future is for nurses going into CDI? You know, there's some statistics that I read maybe sometime this time last year, and I don't think it changed much, but it was from ACTIS, the Association for Clinical Documentation Integrity Specialists. And they highlighted that about 72% of CDI specialists are RNs. Are you familiar with that?
Familiar with that statistic?
Yes.
No, that's the first time I've heard that statistic as far as how many are RNs. I thought most CDI specialists, I thought it was a field where, you know, I haven't seen many postings where you know, you could be LPN or you could be a coder. I just haven't seen that. I have had people reach out to me, you know, expressing that they were, you know, LPN or they were a coder or they had a different licensure other than RN and they would like to get into the field.
Is largely dominated by nurses.
Right.
Right. So, you know, this also speaks to, again, how dynamic nursing is and where those opportunities lie. So just thinking about it, because on this here and on my platform, and I'll just give you some background, Briana, just over the years, the focus has always been on nurses making this transition, but also nurses really understanding like coding and coding guidelines. But the reality also is that CDI is very dynamic. As much as it's a niche, it's like nurses' best kept secret. It's all of its niche is still very dynamic, right? And so therefore, your experience with coming into a CDI role was more reliant on your clinical knowledge, which is the reason why you would promote a nurse who's interested in transitioning to CDI to really get a firm footing on, you know, the pathophysiology and the pharmacokinetics and having like that clinical background and knowing how to provide patient care and seeing that bigger picture from the clinical side. Where for me, I would promote that, but I would also promote nurses understanding the coding side. But a lot of that is because from the payer side, we're not really touching patients, right?
Right.
And we're kind of further removed from the actual patient contact. And so I think because you are a little closer to the action, if you know what I'm saying, right? And for the most part, you're doing concurrent reviews, looking at patients while they're in the hospital, right?
That's right.
And I mean, right. So that with that being said, those nurses would have to have nurses who are interested in working in patient CDI would have to have like that kind of knowledge base. Where if you're working more for a payer, you would have to have more of that coding knowledge. Now, I know some folks who would say, well, you can't work in CDI without, you know, the coding knowledge, but that's not an argument that I want to make for today. The argument that I want to make for today is that nurses can get into CDI, into inpatient CDI, without that coding certification and learn this information as they are working their roles out But while they are learning that information, I would probably advise nurses to take the time to actually learn more about coding as well, if there is a deficit. There may not be a deficit depending on how you approach learning, right? If you approach learning from a perspective where, if you follow along the resources that you're provided, or if you're more proactive, where you probably would seek out additional assistance, then of course you would definitely want to connect with someone like a coder who could give you that additional assistance if you are lacking that. But I definitely want nurses to really see how dynamic these opportunities are, and to come into this space with an open mind. Again, there's different experiences between myself and Briana, but we still both work in CDI. And so we really want nurses to consider this as a real option. Briana, could you provide a place for nurses to contact you?
Sure. So in November, I launched a social media platform, which is called Ditch Bedside, Break into CDI Nursing. And pretty much this is a platform where I share resume, behavior-based interviewing, proficiency tests, tips, just kind of like I said in the beginning, I kind of jumped into it. I didn't have any mentors. I didn't have anyone that I knew that worked in remote CDI nursing. I didn't know many remote nurses at all. So just kind of compiling what I feel would have been useful tools before I got into remote CDI nursing. And I put it on this platform, like I said, Ditch Bedside, Break into CDI Nursing, for Instagram, Facebook, Ditch Bedside again, Break into CDI Nursing. Also on TikTok, Ditch Bedside, Break in, and then the number 2, CDI Nursing. Also, I do have an email address where you can reach out to me. I do also book one-on-one consultations for nurses that want that extra support. The email is info@ditchbedside, break into cdinursing.com. Again, that's info@ditchbedside, break into cdinursing.com. And if you need additional support, like I said, one-on-one consultation, if you need to reach out to me directly, my phone number 919-724-3916, and I'm pretty accessible. You can reach out any questions you have. I'll answer those as soon as possible. But like I said, if you need something more thorough, where you just feel like you're completely lost and you want to sharpen your behavior-based interviewing skills, you want to sharpen your resume, you need some resume tips, you want to go over the basics of CDI nursing so you won't go into an interview completely blindsided. You want to know what a day-to-day life would be like in remote CDI nursing. I am available for one-on-one consultations, and that link is in the bio on the Instagram page, which is Ditch Bedside, Break into CDI Nursing.
We want to hear from you. Schedule a free consultation or send us an email at advancednurses@acd4n.com, or visit our websites, www.advancednurses.info or www.acd4n.com.